19-year-old is about to undergo plastic surgery. She says she wants to change her nose.
I just want to have a smaller nose, no bump, nothing, normal.
We're going to see the results of this young lady's plastic surgery, but first, before we get to that, we're going to talk to some former plastic surgery patients. People who are here to warn us, basically, about any kind of horrors about plastic surgery, some of which they have gone through themselves. How can we avoid it? Well, believe me, you're going to hear some stories today that are going to make you think twice about going under the knife and also equip you with some good information in case you are considering plastic surgery. Stick around. We believe this is something worth talking about next on Rolonda. You know, there probably isn't a one of us that hasn't at one time or another actually thought about having a bigger or smaller chest, a bigger or smaller nose, a flatter stomach, or even a face without wrinkles. But our next guests say that before you make that appointment, you better listen up. Roz Ross went under the knife for a breast enlargement. Lynn Matthews went for a breast reduction. Both thought they were buying beauty, but they woke up to what they say was a real ugly reality. What happened? Roz, why don't we start with you?
Well, in my early 20s, I actually believed, I didn't have any images that said I was beautiful. I was black and American. I didn't have any images. So I believed that the Barbie doll was the image I wanted to be. So I got involved with this doctor, who is now unlicensed in California, but I got involved with this doctor to have my breast enlarged because I believed that that would make me more attractive. I believed that I would be more sexually desired. And this is the real reason I did it. I did not realize at the time that this doctor was not a licensed plastic surgeon. So I went to his office in San Francisco, and I proceeded to go through the steps to have the surgery done.
How did you find this doctor's name, first of all?
The streets. Just the streets. People I met, I knew someone, I knew a dancer who had her breast enlarged. I liked her very much. I trusted her. She led me to this doctor. In getting to the doctor and getting to this point, I wound up in San Francisco in his office under local anesthesia. They gave me 100 milligrams of Valium. I didn't think at that time anything was wrong. The doctor was at my left. He started the procedure, started doing the surgery, and we talked to one another. We actually were talking to one another. I was drowsy. If I felt pain, I would tell him, and he would say it was going to be okay. From my left side, he finished my left breast, and he proceeded to work on my right breast. And the reason he went through my nipple, I didn't want any scars. I didn't want to be a freak. I didn't want anyone to think that I had had this done. It was unusual for a black woman to have breast surgery, I thought. So as he did the incision, everything still at this point was fine. I felt a jerk, and I felt his finger. I saw it with my own eyes because he was trying to push this bag inside of me. And I said, is there something wrong? And he said, something like, did your finger break the bag? I thought he was going to take it out. He told me no. He said it's going to seal itself.
The bag will seal itself.
That's what he stated to me.
That did not happen. You was far from that.
And I trusted him. I believed in him. And I didn't think that you could pay someone to kill you or deform you. And
what happened after that? It was a little while later.
After that.
Oh, God, I'm sorry. I'm sorry.
Okay, now I got a little ahead of myself. I still he was, after he gave me the Valium and the anesthesia here, they said something about police were coming. And he told, I remember him saying to me, you have to get her off the table and get her out of here.
You mean that were you in a hospital or a doctor's office?
No, I was in an office. I was in a doctor's office.
And the police raided it in the middle of your operation?
And the police came to the office, and I got up. My cousin, Stacy, and his assistant helped me up, and they helped me to my sister Verdel's car, and I got into the car, and I sat there until it was clear. And I went back in, and you would think that I would have had enough sense to realize something was wrong.
Roz, why did you go back in there?
Because I wanted what I wanted, and no one couldn't have stopped me, my mother or no one.
You wanted bigger breasts, more than...
I wanted to be wanted.
Oh, Roz.
And I wanted to be wanted. I wanted to feel good about myself.
At whatever cost?
At whatever cost, and it was devastating to me afterwards. And I laid back down on that table, and I let this doctor close me up with a hole in the implant. And I put on a bra, and he wrapped me up, and I got into the back of my sister's car, and I laid down. And I went home, and I stayed doped up for a week after that, and I still didn't realize anything was wrong. And then as the months went on, it was like pink. I felt fever, I felt pain. I went back to him. He still didn't tell me that something was wrong, and I didn't have enough sense to know there was something wrong. And 3 months later, I had to go out to the hospital. And a doctor took a razor blade. He told me, he said that he could not give me any anesthesia. And he took a razor blade, and I have a hole, I have a dimple right here. And he said he made an incision, and he took it out, and the blood and this clear jelly type stuff. And I remember the burning, and I remember the pain, and I remember when it was flat and it was over. I thought, no one's gonna really like me now.
Oh, God. Honey, I'm so sorry. Come on. I'm so sorry. You know, we wanted to do this show because we don't want anybody else to end up in that type of situation. I know that when you spoke with our producer, you said that you really wanted to get the word out, to warn people.
I don't want any young person to go through what I went through. I want them to believe that you've got to find the happiness within yourself. Bigger breast, plastic surgeries are wonderful for people that search out and understand what they're getting into, and that check the doctors out. Talk to your parents, talk to someone before you do something like this. I have a scar, I have scars on my body now. It doesn't look right. In all these years, I've lived with this. I gained lots of weight, and that's just the way it is. I don't want anyone else to go through this.
Okay.
I don't want anyone else to go through this.
Okay. We'll be right back in just a minute. Some of you who are watching the show today are trying to decide whether or not to have plastic surgery. Many want to have it in hopes of improving their appearance and maybe even meeting somebody of the opposite sex. Some of us think it'll make us more enhanced. We just finished speaking with Roz, who had a very difficult story. Roz, I don't think there's a dry eye in this studio. That was something that affected all of us. One of the things that I heard that really hit me was how desperate you were at that time to look beautiful and thinking that going under the knife was what was going to change your life and make everything all right.
I believe that.
You do.
I did. I did.
I mean, I think especially women. I know guys get surgery too, but I think especially women. We'll do anything, alter our bodies to, you know.
That's true.
Yeah.
That's true.
Lynn, we were also introduced to Lynn, who had a difficult time. You went in for a breast reduction, is that right?
Reduction, yes.
And during the conversation we were having here, you said that you could relate a lot to what Roz was saying.
Oh, definitely. I started out and I was a 44 double D. I was extremely large. It was affecting me medically. I was very sore in the shoulders, and people would look at me funny on the streets. I would be walking with my husband, and their attention would go straight to my chest and not to my face. I was very, very uncomfortable. So I decided to have the surgery, and the surgery went fine. And then after that, 4 days later, I went to go see the doctor. I was wrapped in ace bandages, and the doctor, he seemed to think that we were going to have a problem with my left side. So I went back to him, and I developed a hematoma.
And what's a hematoma?
It's blood and fluid under the tissue. And at that point, I started running a fever. So
now this shot is very graphic, but what are we looking at here, if you could tell me?
This here is, I lost my nipple. I'd had 2 debridements where they had removed dead tissue from the infection that I had. It started out as staph infection, it went into pseudomonas, and it just kept on eating my breast away.
How did you get the infection, though?
They don't know. They don't know.
What did that do to your life?
It just turned it upside down. I mean, luckily I had a husband that supported me, but I had to file bankruptcy because of all the surgeries that I've had. I've had 10 surgeries.
Oh, God.
Okay, just to reconstruct me so I can feel comfortable with myself. I've sought counseling, and just because of all the anxiety before I go into surgery, I'm just always worried about whether I'm going to come out of it. Okay, I have a child that's 4 years old, and I'm always wondering if I'm going to come out alive, or you know, I need to be there for him.
Right.
And it's really hurt my life a lot. It's changed it. It really has.
Is there a support system for you? Because I guess, I don't know, it just seems like such a private thing that you go in for, and then when there's even more of a difficulty, it's even more of a private matter, particularly since it's your breasts or something. Do you have a support system, places that you can go?
I didn't find any, no.
I didn't either. I think my support system were my friends. Were my friends at the time. I definitely didn't get it from my boyfriend. I mean, he took me out on a date, and I hadn't really told him. I hadn't seen him for a while.
Right.
And we were going across, across a bridge and a overpass, and I told him what had happened. And he made a U-turn and turned the car around and took me home, and I had to get out of the car like I was just deflated totally. Just totally deflated. I got out of the car, and I mean, it was like I was slammed twice because someone I trusted, a doctor I trusted, slammed me, and then this, he was a teacher, he was an educated man. He said, he explained he just couldn't deal with it.
We have 2 other guests who are joining us now who are shaking their heads, because I see that you can always look at these sisters relating. I mean, it's a shame that we can't relate on better things, but I guess that's when it means the most to have somebody next to you, when you can relate in difficult times. Our next 2 guests are shaking their heads, and you obviously can relate to what Lynn and Roz are saying. I want you to meet Marcy Soto. Marcy decided to have a facelift and a brow lift, but her plastic surgery led to partial paralysis. And also joining us is Pat Davis, a woman who says that ever since her disastrous facial surgery, she believes she's destined to live life alone. Live life alone? Why?
Well, who would want someone that's all scarred? I have a hole here in the side of my face. The whole side of my face here looks like I'm burned.
How did...
One earlobe I have is sewed to the side of my face here. The other one, I have an earlobe. And who would really want someone like me? I looked much, much better before this. Much better.
How did all of this happen? How could this happen?
Well, I was a young widow, and I thought, I adopted my granddaughter, and I thought, well, she's going to grow up, and I'm going to be left alone. And I waited about 7 years. So I kind of noticed I had some wrinkles just around my eyes. And I asked the doctor if he could remove them. A good doctor, I checked him out. And even the weather lady, she even went to him, but she didn't look like me.
Okay. I know that you had, when you say the weather lady, there was somebody in your state, in your local area, the weather lady who had used the same plastic surgeon. And from what I understand, you said, well, if it worked for her, who's somebody on television, it could work for me. And you'd used the same plastic surgeon.
So I was on, he just numbed my face. And while he was numbing it, the nurse said something, and I could feel him ripping the skin away from my face. And I heard the nurse say, uh-oh, and he said, put her under, put her under. And when I woke up 2 or 3 days later, I wouldn't even look in the mirror. They wouldn't let me look in the mirror. And when I went home, I wrapped my head up all over, and I stayed in my home. I would not go outside. And I had a big hole, and I was burned all through here. Why I was burned, I do not know.
Oh, God.
And my oldest sister, she was a nurse, and she helped, and she kept saying, your face is not going to heal. And everybody said, why don't you go back to the doctor? But I didn't want nobody to see me, so I just stayed in my home. I gave up my life, and I've never remarried. I never wanted to get married. Who would want me?
We talk about how beauty comes from within, and but when somebody does something like that to you, what did the surgeon say? I mean, have you gone back? Could you?
No, I never went back. I didn't want to go back to him after he done this to me. I was afraid what he would do to me. Okay. So I just stayed in my home.
Okay. Marcy, we're going to get to your story next. Let's just take a break. We're also going to meet some other people who are going to tell us things to look out for so this could never happen to you. We'll be right back.
Hey, Ro on the go here. Just wanted to drop in and say thank you so much for watching. I hope you'll subscribe to my channel and then go and enjoy all the other good stuff I'm doing in here. Some good stand-up comedy. There's some good advice from Auntie. There are podcasts. And, of course, some great Rolonda shows and wonderful moments behind the scenes of some of the many places I adventure. Like there's no telling where I'm going now. In the meantime, go back and enjoy the show. Let's get back to it and see what happens next.
I want you to meet Marcy. Marcy can relate so much to what the ladies on our show today are talking about. Marcy, you went in for a facelift.
Yes, I did.
And what happened?
Well, they told me that everything was going to be just marvelous, that the doctor was wonderful, and that I would be nothing less than perfect. And I was out for about 5 hours, and then when I went home, I had a scratched cornea in the right, and later another doctor told me that they had drug a wet sponge across my eye. And then a few weeks later, I noticed that my left eyebrow wouldn't raise at all, and it's paralyzed. They severed a nerve in the left side of my cheek right in here, and this side of my face is pulled. And this brow won't raise at all. See, the right one will, but the left one doesn't.
Wow.
And my hairline is back so far that I'm so embarrassed. Look at that. It was not nearly back like that, and he told me that that wouldn't happen.
Who was this doctor?
Can I say his name?
No, our attorneys are waving over there saying, no, we can't. You know, I think, you know, and quite honestly, maybe I don't mean who was this doctor in terms of what was the name, but
was he a prominent
was he
doctor?
certified?
Yes.
Was he a plastic surgeon? How could something like this happen?
He was a certified plastic surgeon, but he was not a cosmetic plastic surgeon, and no one told me that.
And there is a difference.
There is a difference.
And can you tell us what the difference is between,
from what I understand, just a plastic surgeon, they can do hands and body parts, but when you start to do your face, you need to be precise, you have to have finesse, you have to be a sculpturist, you have to be very artistic. And I didn't know that made a difference either, but I really wasn't told of much about his qualifications except how wonderful he was.
Where did you find the information out? Was it a friend who told you about the doctor?
I just did it on my own, and I trusted him. You get romanced when you go to see a plastic surgeon. They romance you.
What do you mean romance you?
They tell you how great they are. The nurses tell you how great they are. Everybody feeds you this story about you're going to look wonderful, don't worry, everything's going to be just fine. You're going to be just great. Nothing's going to go wrong.
All of you are agreeing to that. Is that what they?
How great you're going to look. This is going to be.
That's what they tell you.
It's going to be a whole new you.
Everybody in the office tells you that.
My doctor walked in. He was so tall and handsome, and I believed him. I mean, his presence, his body language, told me that he knew what he was doing, and I trusted him. I actually submitted to him. And gave up my money. I had no idea that I was going to be paying for someone to deform me.
Right. And how much does this cost? I mean, thousands of dollars.
Thousands.
And then if something gets botched, you have to go back in for more reconstruction and the.
Oh, but they don't have anything to do with you. They don't want you.
They
do
attitudes.
not want to see you.
I was going to say, when you called back and said, look, I've got a problem here. Something did not go right.
Well, they won't make any money. I mean, we're not talking about good plastic surgeons. They are people that when they took that oath and they took that extra training to perform surgeries for cosmetic reasons on people, human beings, we're talking about bad doctors that really all they cared about was the dollar. And think of what they'll lose if they have to redo. They lose.
What really scares me is just the emphasis on beauty as it pertains, and young girls who are just going to run in there and not do their research. And I mean, not just young girls. I mean, some of my friends are thinking about plastic surgery. But I just think this is a real good wake-up call for anybody thinking about that. Basically, just do your research. We're going to come back and we're going to talk with a woman whose stomach scars severely affected her marriage. We're going to talk to a husband with her, and we're going to see how a botched plastic surgery can affect the whole family. We'll be right back in a minute. To some real horror stories that have happened when plastic surgeries go wrong. We're certainly not saying that plastic surgery is bad. We've seen some wonderful outcomes in plastic surgery, and there's some excellent surgeons out there. But every once in a while, if you don't do your research, things can happen, and we're here to warn people. I mean, can you imagine, for instance, if you went into the hospital to have a scar removed and a tummy tuck, and you wound up with holes in your stomach, a blistering infection, and a life that had basically been turned upside down? Dawn Burke can relate to this. She suffered through the physical pain and the strain that this type of travesty put on her marriage. This is her husband, Andrew, who had to go through all of that with her. I think what this represents is what a family has to go through. It affects more than just one person. Dawn, how did you end up going in for the tummy tuck? How did it all start that way? Take your time, darling. Oh, Dawn.
I'm sorry.
I know, sweetie. You're not alone, you know? You take your time. Andrew, why don't you talk about it a little bit till she gets it together?
Well, she had a keloid type gallbladder scar. It was getting real thick, and she just wanted it removed. And the doctor told her it was no big deal, of course, you know. As she said, it was kind of romanced her. And because he had to pull so much skin over, there would be a little lump here, and you have to do a tummy tuck. She ended up getting cut from hip to hip, and from the middle of her chest down, intersecting. And then she got infection in the hospital, staph pseudomonas infection, and it turned pussy. It was running. Sutures wouldn't stay closed. It kept breaking open.
These are some of the shots of Dawn in the hospital here. Dawn, gosh, your whole body was taken over there. How did you get through that? I mean, what do you say when something like that happens?
Well, at the time, you don't get through it. You just...
Your mind goes. I laid in that hospital, counting holes in the walls, you know, just to keep my time, because I spent 17 months.
Oh, my God.
I didn't see my kids. They thought I died. And I actually didn't want to live anymore after a while. I just couldn't stand it. I couldn't stand the horrible surgeries, the pain, the smells. They still come to me every time I have to think about this.
You were so full of infection.
Not according to my plastic surgeon.
I know this is not the right thing to say, but this is somebody who's juggler you need to go, you know?
I did. I used to lay in that hospital thinking, if I get out of here, how can I kill that man? He's killed my life. My children think I'm dead. My husband couldn't stand to come around me because of the way I looked.
You guys had recently gotten married when all of this happened,
Yeah.
is that right?
Yeah.
What year?
Andrew, how did you deal with it? What I mean, how do you get through something like, I mean, I am just so shocked right now. I'm just I don't even know what to say, to be honest with you. I feel anger. I feel extreme hurt and pain for you. And yet at the same time, I really want your story to make a difference for somebody out there who's considering doing the same thing.
Just don't do it. There is nothing on earth that can come up and say, oh, get it done, you'll look great. Well, there probably is somebody that did look good for it, but the circumstances and the things that can come from it, and from a doctor that can't tell you the truth.
That seems to anger you.
He cost me my life almost.
Yeah.
I was dying. They told me I was dying. And I had to learn to walk again. I went in there not very scarred so bad. It's just keloid meant that it was getting old, hard and thick. And he says, I'll make it as thin as a pencil line. And God, 6 weeks you'll be out working again. I was doing landscaping work. 6 weeks later, I was in a hospital fighting for my life because he sent me home with green and blue pussy holes in my stomach, a high fever. And the filth that I went through during that stay from the hospital was terrible. They were filthy. Nobody should have to go through this for any reason.
You are absolutely right, and that is what we're trying to do. We're going to continue this conversation in just a minute. To Jeanette here, the lady I met in the audience, and she was saying, you said you were thinking about having a tummy tuck yourself until you heard this.
Yes, I was, because I've been trying to lose my stomach for the longest, and it does not go down at all.
Yeah.
And after hearing her, I decided I'm not going to go through with it.
Yeah.
And I just want to say that my heart goes out to everyone there, really. I really feel for you. But are these doctors still practicing what they did to you guys?
Yes. All of them, except for you, Roz.
My doctor did lose his license in California. Yes, he did. As a matter of fact, I mean, it was a mess. It was a mess. They tried to get me to testify against him, and It was a mess.
You were even saying that you couldn't afford to sue this guy if you wanted to.
I went to top lawyers, and one lawyer wanted $5,000 up front.
Wow.
And I just couldn't afford to do it. I just could not afford to do it. $5,000 is a lot of money.
Right.
And it still is.
Yes, question.
Yeah, is there any effective legal action now that is taken besides lawsuits to make sure that they can practice? Are they being imprisoned? Community work? What are they doing? What is being done against them?
Yeah, how do you punish somebody who...
By coming on your show and talking about it.
Yes.
There you go.
Any other questions from the audience? Yes, come on.
Can't you report them to the board?
Boy, I tell you, because if it doesn't make the headlines, which things don't, because I guess people are...
that's right.
I applaud
That's
you
right.
guys for your courage. It
That's
takes a
right.
lot of bravery to
That's
take the
right.
stand that you are. Question, yes.
Yeah, I was wondering, who do you go and see to check these doctors out?
You can go to the board. You can go to the plastic surgery boards. You can go to the medical boards, because if they're board certified, they are on record.
And
Their
if he's
licenses,
good.
if they've ever been
That's right.
sued, it's all there. You
That's
go
right.
and look for it, and everybody do it.
If he's a good and caring
Before you
doctor,
even
he'll
get
be willing to
operated on.
let you see other patients, talk to other people who he's actually worked on. Get all the information you can about this person.
And get second opinions,
Oh,
and the
yeah.
third, and a
Definitely.
fourth.
That's right.
And go on from
Yes.
there.
It's your body, and even though we're here for a short time, you don't want to be scarred if you can
No,
keep from
you
it.
That's right. We're going to also have a plastic surgeon who's going to come on the show a little later, who's going to tell us specific things to ask, what you should look for, and where you should look. If you saved up your money and raised your hopes all in anticipation of undergoing plastic surgery, only to wake up with scars under your eyes, wouldn't you try to warn as many people also about the problems that you could possibly encounter? Well, my next guest, Tim Hogan, come on, Tim, and join us here. This is Tim Hogan. He has taken action of a very different kind against the surgeon who, he says, ruined his face. Tim is somebody who goes right to the streets. He walks around his town, he hands out flyers, talking about this surgeon. He wants to warn other people and prevent them from making the same mistakes that he might have made. Boy, you certainly do take right to the street, Tim. Thanks for joining us today. What happened to you? What is your story?
I went to a doctor to have him take the bags out from under my eyes, and they tried to talk me into having some, excess skin on my eyelids taken off to make my eyes larger. Well, I went ahead and did it, and my scars never healed, and this eye is larger than the other eye. Oh. And I went back to the doctor about it, and showed him the scars and showed him how this eye was larger than the other one. And
what was his response when you did that?
His response was, with a smirk on his face, that my skin was too sensitive and that it was not his problem.
Well, it was his operation.
Yeah.
Why didn't he tell you that before you came in?
And on top of that, this devastated me. I seriously thought about taking my life, and I live along with this doctor in Marin County, and the Golden Gate Bridge is only not far from where I live. I told this doctor I was so devastated I was thinking about jumping off the bridge. He said he would drive me there.
Oh, come on.
He said he would drive me there.
What does this do to your life? Because I think you have beautiful eyes. Yeah. And I know that maybe you've camouflaged them or something, but I know that it's more than what I see. It's what you feel inside because of this tragic situation.
Well, Rolonda, people say it's inside and it's the beauty inside that really counts, and that all sounds real good, but let's get honest here. Excuse me. I mean, we all want to look as good as we can, and it's devastated me. When I shave now, when I have to look in the mirror, I never look at my eyes. Never look at my and it's amazing. We have no recourse.
That we don't.
No recourse, because it's the good old boys that cover each other. So I've passed these flyers out, and I'm going to continue to pass them out when I go back to Marin County, where this doctor works.
Okay, Tim, continue the fight. Man. Cool. Thank you so much. It's time we bring that doctor out here, a doctor who tells us that he's heard many of these stories, many of these kinds of stories. He's going to talk to us about how we can avoid being a bad plastic surgeon's next victim. He's also going to show us some of his successes. We'll be right back after this. We've been talking today about unsuccessful surgical situations when we deal with plastic surgery. But you know, plastic surgery, we must say here, as many know, that it can have some very pleasing results as well. Joining us now is Dr. Robert Vitolo, who will tell us how to get some positive results from plastic surgery, what somebody should look out for when searching for a surgeon. I can't help but say, Dr. Vitolo, that some of the stories, well, they are the exception. There's some pretty horrible exceptions. We're trying to help people avoid these situations. So the number one thing that you would say if you're looking for a plastic surgeon is to do what?
Well, first of all, Rolonda, one should research the physician that you choose. One should obtain more than one consultation. One should look at qualifications. The standards, our society sets certain standards for driving a car, flying a plane, and they also set standards for doctors that want to call themselves certified plastic surgeons. Mm-hmm. There's an organization called the American Board of Plastic Surgeons that determines the training of plastic surgeons and also that tests the skill of plastic surgeons. Mm-hmm. A board-certified plastic surgeon has passed certain requirements that require him to train. Mm-hmm. That doesn't mean that the plastic surgeon can't make a mistake or can't be greedy or can't be not good, but your chances are most likely that you will get a physician who is qualified if you look for board certification in plastic surgery.
If you get a doctor's name, can you also get some of his, like 5 of his past patients that you could call and check up on?
You can ask the doctor. Mm-hmm. Many doctors will, I know in my practice, we don't get that request of that very often, but many times, if we do, we'll find a patient who doesn't mind talking about their surgery and ask the patient to call the prospective patient.
Question.
Yes, we applaud everything that all of you up on stage have been doing. My question is exactly how many times does it take a complaint, or how many complaints does it take before the AMA or somebody finally starts to take notice and say, maybe we ought to start researching this doctor and find out what exactly he or she is doing wrong? Mm-hmm.
Well, there's no particular number that I can give you, but I can tell you that any doctor that works in an accredited hospital has to meet what's called peer review. Mm-hmm. If you perform surgery in a hospital and you have many complications, it goes before a committee in the hospital, and they keep track of complications that occur. Now, doctors that operate exclusively in their offices don't have this requirement. So if a doctor is a member of a staff of a recognized hospital, he has to meet very stringent requirements. If he has a lot of complications, he has to answer for them. And in New York State, these complications are reported to the state when they are of a certain magnitude.
Mm-hmm. Question.
Yeah, my question is, you're saying if they're in a hospital now, many of these doctors work out of their office. Are they hooked up with a hospital in case the person has to go?
Most doctors, and I can't speak for all, but most doctors that operate in their offices have an affiliation with a hospital. And you could ask a doctor that operates in his office, do you have an affiliation with a hospital?
Mm-hmm. Question.
I'd like to know where the statement that patients need to sign in order to acknowledge the risk involved, where does that factor into the outcome, negative outcome?
It doesn't have anything to do with the negative outcome, but what it does is it apprises patients of the risks and complications of surgery. Surgery is not something that one takes upon lightly. It is not without risk, like flying an airplane is not without risk. Mm-hmm. The patient needs to know and has a right to know what they're letting themselves in for. And that's mm-hmm. why we ask patients to sign statements that they have read prepared information, that they've been exposed to the risks.
Okay. We're going to continue with this. We've got to take a break. And when we come back, we're also going to see Nicole. Do you remember the young woman who you saw at the beginning of the show? who was going in for the nose job. We're going to see how that nose job turned out and get firsthand what her experience was like when we come back.
So I hope you're enjoying this episode, and I hope you will subscribe and continue to enjoy. Just wanted to let you know that my voice acting masterclass is now digital. If you are somebody who's interested in being a voice actor, please go check it out. Go to Rolonda.com, Rolonda.com. That's my website, and you can check out all the details and even enroll in my voice acting masterclass. Hey, you'll never know how good you are until you try. Now, let's get back to the show.
Remember Nicole, the young lady we saw at the top of the show? Well, let's take a look at what happened to Nicole. Nicole says that she's always hated her nose. She said that a new nose would improve her life and give her self-confidence. Her mom told her, though, that she didn't think it was necessary.
I'm not really happy with the idea that she's doing this because it's her face, and to me, she's beautiful.
Well, you know how young people are. Nicole went on ahead and did it anyway, and 2.5 weeks ago, her dreams came true. Nicole got her new nose. Well, now, let's take a look at Nicole now. Come on, Nicole, stand up. Are you happy with what happened?
Yes, I am.
Well, you're such a pretty girl. And those red eyes, that's part of the surgery. That's what happens.
Not
after
everybody gets it.
Yeah, but that's part of. What was the experience like? You've heard us talk this whole show about warning people, and you obviously made a good decision for you. Anything you can tell us about your experience that?
I would not recommend it to anybody.
Why?
Everything just went fine. No pain, nothing. And I mean, do what's good for you.
So what you're saying is it worked for you, but you
Right.
wouldn't go out and push people to go and do it.
I wouldn't push, but I wouldn't tell them no, don't do it. I would never, no.
Okay, did it hurt?
No, not at all.
Not at all?
Not at all.
Not at all?
I would do it again.
Has life improved for you now?
Well, I didn't start going out yet because of my eyes, but I'll let you know afterwards.
Well, we're going to check in with you, and you let us know if that worked. But it's good to hear a success story, at least in all this. And, Mom, you okay with this? Mom says fine. Okay, Nicole, thank you so much. We'll be right back. Dr. Piccolo was pointing out that even if you did have a plastic surgery that didn't work for you, that there is hope, there is reconstruction. Eric and Mark are perfect proof of that. Eric, you just had a nose job, right?
Yes, on April 11th.
Okay. Doc, why don't you tell us a little bit about what had happened here?
Eric had a rhinoplasty by another plastic surgeon who made his nose too small. And in the surgery that I did, I made his nose larger, putting in an implant and lengthened his nose. He was a big, strapping guy, and he looked like a pixie before. So what we did was we made him look like the big, strapping guy that he is.
Okay. Here's another big, strapping guy here, Mark. Let's see the before and after of Mark as well, and tell us what you did, Doctor.
Well, Mark told me that after he had his nose done, he didn't see much of a change. Now, I redid his nose and gave him the definition that he needed. Now, he's only 3 weeks after surgery, and he'll get much better. And,
Wow.
and Eric is 1 week after surgery.
What a difference. Look at that. Isn't that so? A happy man here. What would you say?
If your nose goes on strike, pick it.
Oh, come on. Thank you so much for being with us. Remember, as we always say on this show, and as you already know, knowledge is power. We thought this was something worth talking about today in case any of you are considering plastic surgery. Do your research, please, and join us again next time on Rolonda.